Hello guys, this is my assignment speech 2. The purpose of this assignment is to shed light on the cost of imaging and testing done in healthcare and the solutions to combat those expenses for people in poverty. My audience is targeted for people that have troubles financially and can't afford to pay for healthcare bills. According to the United States, according to the United States Census Bureau, as of 2022, there were 37.9 million Americans in poverty, which is 11% of the United States population. Also, according to an article by the Social Security Advisory Board called The Unstable Cost of Healthcare, it states that we believe the rising cost of healthcare represents perhaps the most significant threat to long-term economic security of workers and retirees. The fact that some people live paycheck to paycheck just to pay rent, utility bills, and barely even enough to scrape by for food a week or 2 weeks is hard when an accident happens, you know? Then it becomes a fact that, oh, how am I going to pay for this medical bill? How am I going to get the help that I need to make me feel healthy again, you know? When you think about the hospital, the first thing that comes to mind is personal health and not, do I have enough money to see if I'm healthy? But for some people, that's the sad truth. Healthcare isn't cheap. And the last thing you want to think about is how much will this cost? Luckily, there are some ways to pay your medical bills with the aid of government. Government assistance and aid. The government assistance used as an aid for people that can't afford to pay medical expenses, and the scans used for medical imaging are covered according to the United States. According to the United States Census Bureau, in 2021, 37.3% of people rely on Medicaid or Medicare, which are government-assisted plans that act as a solution to try to combat the struggles of poverty. Medicaid is a government assistance insurance plan that provides little to no cost aid with medical imaging bills, so that the people that don't make enough money are allowed to get the help that they need from the healthcare. There's also Medicare Part B. Is another government assistance insurance program that helps people 65 and older pay for their medical imaging. If their provider requests it, then it is covered by the insurance, but the provider has to request it before or it won't be covered. But the patient must cover a 20% deductible, making Medicare a little bit more costly when looking at it. According to an article from the Agency for Healthcare Research and Quality According to an article from the Agency for Healthcare Research and Quality called Reducing Costs in the Healthcare System, Learning from What Has Been Done, it states the burden of cost sharing fall mostly heavily on those with multiple chronic health diseases and on Medicare beneficiaries. With the help of government assistance plans, people that face difficulties of poverty have a way to get health care with little to no cost. Medicare Part B and Medicaid are two great solutions when faced with poverty to pay for expenses that come with a medical scan or any medical tests that are done in hospital or clinics or anything. It is good to know that even if you are in the worst spot that you can possibly be in, there are government assisted plans out there that allow you to get the help that you need so that you can be to your best self again.